Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello, welcome to another episode of the Healthcare Connections podcast. I am your host, Jeremy Winn. I'm so excited for today's guest. He is a very good friend of mine and somebody I've wanted to have on the show. As soon as I decided we were going to do a podcast, this was one of the first people I thought of because I know the service that he provides could be so valuable to our clients. So I want to welcome our guest, Matt Vance. He is the co-founder and CEO of a company called Mobrium. Welcome, Matt.
Hey, thanks, Jeremy. Really appreciate the chance to be here.
Absolutely. So instead of me butchering this, let's go ahead and have you give a quick introduction of yourself and your company, and then I'll jump into a few questions that I think could lead us in a good direction to be beneficial to the listeners today.
Perfect. Well, my name is Matt Vance. I also live in Logan, Utah, right where Jeremy's at. So we've known each other for quite a few years as friends. And I've been in the feedback space for about a decade. I started on the customer side, managing online reviews on e-commerce platforms like Amazon, Walmart, Wayfair. And then pretty soon realized that a lot of those same strategies for using customer feedback to reverse engineer a better product and a better customer experience could also be used to employee feedback to reverse engineer a better company culture and employee experience. In 2022, I published my book. You can see it behind me, The Review Cycle. It's all about optimizing and managing public feedback found in online reviews. And that same year, 2022, my wife and I launched a company called Mobrium. We have a software platform that follows the methodology of the book, and we help employers win on sites like Glassdoor and Indeed. So we offer ways to automate employee review requests and manage every step along the way.
That's awesome. Yeah, I should have mentioned and author of I'd call it an award-winning book. I know you've received a lot of incredible feedback and had a lot of success with the book. So yes, and author. I did not mean to shortchange you, Matt. Thank you for also adding that in there. Cool. Well, thank you for the introduction. Let's jump into a few questions. I hear this a lot from our clients here at Healthcare Compliance Pros. Um, there's a big need in the industry to always try and recruit and retain the best talent. It's an open door a little bit in healthcare where people are coming and going from organization to organization. And so we get asked a lot when it comes to our compliance training. They ask us all the time, how easy is this going to be for my employees? Because it's a big deal for us to keep a good company culture and to make things simple for them. So I know this is a concern on how to retain and recruit talent in that industry. So first question for you, Matt. How do employer ratings and reviews apply and help healthcare organizations in that industry?
That's a great question, Jeremy. And honestly, we see there's a lot of scrutiny in the healthcare space right now in the media. We've had the really high profile murder of a top CEO at an insurance company, which was pretty crazy to see. And so what's found online directly reflects on companies, and whether it's true or not, it's shaping perceptions. If you've heard the phrase perception is reality, that's very much true when it comes to sourcing social proof that informs decision making. Everybody references online reviews and ratings when they're shopping for a product or picking a restaurant to go to. But honestly, as the consideration of the decision goes up, we as consumers are willing to invest more time to research. If you're buying a car or a home, you're more likely to research that brand or that make and model or that home builder. And when we talk about the healthcare space, there's definitely a lot of consideration that goes into that decision, especially for elective elective surgeries where
Mhm.
it's for yourself or loved one. So when we talk about employee reviews, honestly, they're an extension of a product review because it's the team members at a healthcare service provider that are sharing their satisfaction with working there. And if
Yep.
someone goes to look up your employee reviews, say you're a hospital, and they see that there aren't great reviews, well, they may choose to do their surgery elsewhere where they feel the the staff at a different hospital is more satisfied with their employment. So we don't look at employee reviews as just the transactional consideration for hiring and retention. It very much spills over to business growth, to acquiring new patients, and appealing to investors. Investors use and reference these reviews for decision making, as well as just showcasing to the community that we're a great employer of choice.
Awesome. Yeah, that I think that's another piece. And I know you talk about this a lot. I've listened to the podcast that you also host. I know you talk about it in the book, but how reviews and employee reputation can lead to revenue. I mean, it has a direct effect, and that, I don't think we think about that a lot of times. I think on product reviews, it makes a lot of sense. Obviously, great product reviews, great service reviews are going to lead to more revenue because more people are going to be driven to your service or product. But a lot of people don't think about the employee reputation side and how that can affect the bottom line.
Yeah, there's definitely effect there. Like when we talk to companies, we typically run some calculations to see the health of their current reputation and how it's impacting their existing recruiting and retention efforts. And those are, I mean, your payroll's typically one of the largest, if not the largest, expense. And if you can improve that, then it's significant.
That's awesome. Yeah. So talk to me, the importance of being proactive. Why is a proactive approach to this employer reputation so critical when it comes to healthcare?
Well, if we're not being proactive, then whatever's found online, it just is what it is. Whether we're aware of it or not, it's still there and it's shaping perceptions. You may have profiles on lots of different sites. There's review sites like Pissed Consumer and Site Jabber. I mean, you can imagine what types of things you could find on sites like that. Like,
I'm gonna have to look that one up. Consumer. I'm gonna go find that one.
yeah, I mean, honestly, even if you had great ratings on that platform, I mean, people aren't even going to believe that. It's just, it's yeah, not a great place, but at least you want to be aware of what's there, so you have the option to manage it in different ways. But if we can be proactive, there's a lot to gain. Most of the time, when we talk to companies, their reputation is underrated. And it's because of this principle called the law of self selecting extremes. And it's something that I talk about in my book. When we don't ask for feedback proactively, the only people that are sharing reviews online are the people that had a way positive or way negative experience.
Yeah.
They're willing to go out of their way to share. I mean, think about your own experience. If you go to a restaurant and it's just absolutely exceptional or absolutely horrible, in those two scenarios, you're likely to go look them up and leave a review. But if it's just like, yeah, that was okay, I mean, why are you going to go leave a review when you have a million other things to do?
Yep.
But as you proactively ask for reviews, you lower the barrier to participate and you unlock the silent majority. That's, the bulk of your customers or employees. Now they're being asked to share, and as easy as you can make it to share, you get more participation, and that is the number one driver to getting authentic,
Okay.
better ratings. Because really, what you're doing is there's no trying to game the system; it's just trying to get more people to share, so there's a more well-rounded, truly reflective experience that's shared online.
Again, much more accurate to your point that I
Mm-hmm.
know me personally, I fit exactly into that mold. Just the other day, I won't name the company, but I had a very poor customer service experience over the course of 3 days. I had to call in to try and get an issue solved. And I spent more than 3 hours each day bouncing
Oh,
back and forth. And when it was all over, they solved my concern. It came out the way I hoped it came out. And I still was unhappy because the
oh,
experience, and I didn't go leave a review because I tried to calm down, but I mean, it was the moment where I couldn't wait to get online to leave a review. And then once they solved my concern, I calmed down a little bit. I didn't want to be that guy that just goes and blasts somebody. But you're exactly right. That motivation is really on the extremes. But to
Mhm.
get a more accurate representation, being proactive gets you, everybody, to be involved. I love that.
Yeah. And one thing I would add to that, just real quick, Jeremy, is when we talk to a lot of companies that this is something that's new for them, they're looking at, what do I do? Like they're getting all excited, like, oh, well, I just need to ask for reviews. This is like a simple problem, simple solution. But we at least warn them to make sure whatever they go out and do, that they're being compliant with FTC legislation. You mentioned the importance of
Yeah.
compliance in the healthcare industry. And just in October of 2024, the FTC rolled out some new legislation around online reviews and testimonials and truth in advertising. And it's the first major legislation that's been released since 2009.
Oh,
But
wow.
there's some very specific things in there about disclosure of material connection. For example, like a manager or an employee leaving reviews, they have to disclose that fact. And we can't ask for reviews of a certain sentiment. So a manager couldn't say to their team member or a customer, please leave a positive review. You can ask for an honest review. So there's some very specific things that you want to be careful of. And the maximum civil penalty is over $51,000 per instance. So it's not something that you want to take lightly. And that's something that we help our clients with, is ensuring that they're compliant in the way they're approaching their online reputation.
That's valuable information. I do remember it came from just following you on LinkedIn, that you guys had talked about that FTC um, ruling that came out. Where, so somebody that's listening to this, where do you start? How do you get going? You're excited. You want to do something to improve your business, to get, more real feedback, I should say, right? More accurate feedback. Best place to start.
Yeah, so the first thing you want to do is, it's really easy. We just need to measure where we're at. Essentially, we conduct an audit. You can do that yourself by just going and looking up your company on all of the different places where people could leave reviews. As far as Mobrium goes, we do that for free when a company meets with us, and we actually go a step further and look at some forecasts of where your reputation could be given some different participation rates. But yeah, the first thing you want to do is measure where you're at. I typically recommend documenting each profile with a screenshot, including the timestamp in the bottom corner of your desktop screen, so you can you can show how things have changed after you've implemented something. And then you can have that before and after impact. But from there, after you've measured where you're at, you want to assign ownership. Who's owning the company's reputation? Typically, when it comes to employee reputation, we see that live in the HR space or the marketing, or both. Some companies have roles for employer branding specifically. And then there's a few more steps for proactively asking for reviews and monitoring the feedback. But the basic thing to start is you need to go measure how your reputation is today, and then you can make a more informed decision to move forward.
What are top two, three sites? I think Glassdoor is a common one people know, but what are some others maybe less known that they could,
Yeah,
check on?
the top four that we recommend: Glassdoor is obviously the biggest. Indeed is huge because it's connected to a large majority of jobs that people are posting and applying for, and those ratings and reviews are attached to the jobs. The next two that we recommend is Comparably, which they've been around for about 10 years now, and they've got a little bit different approach to their culture questions, but they've grown substantially. And In Her Sight is the last one. And this one is actually really big for the healthcare space. Think of In Her Sight as Glassdoor, but for female friendliness in the workplace. It's hyper focused on how employers are being good for their female talent, and where healthcare is very much heavy on the female talent side. That's a platform that I highly recommend everyone in the space really look into and be more active on that platform. Across those four, so Glassdoor, Indeed, Comparably, and In Her Sight, there are over 30 different best place to work awards that you can qualify for without paying entry fees or doing one-off company-wide surveys simply by collecting reviews. And if you have a high enough quality and quantity of reviews in the most recent 12 months, you can meet eligibility requirements to be enrolled in their Best Place to Work award programs, which that can also have a huge impact on reputation, hiring, recruiting, and overall business growth.
That's awesome. Okay, thank you, Matt. All right, we're getting towards the end, and it wouldn't be a podcast with Matt Vance if I didn't ask you for one of your best Christmas dad jokes. And let me just preface this. Again, I've known Matt a long time, and everybody that knows Matt knows he is the king of puns along with dad jokes. So let's end it with a dad joke, maybe Christmas themed if you've got one ready. I don't want to put you on the spot, but go ahead, Matt.
Well, I have this every year. For those of you that are seeing the video, I have a styrofoam cup. And if you don't see the video, it has written on the front of it, "Cup of Cheer." I didn't plan this. I just had it ready sitting on my desk because I use it for other things. But I've got some Christmas jokes here, the literal cup of cheer. So here's one. Knock, knock. Who's the? Oh, I guess I should ask you.
Okay.
Knock, knock, Jeremy.
Who's there?
Pizza.
Pizza who?
Pizza on earth. Goodwill towards men.
There we go. Okay. Thanks, Matt. Again, I knew that's a little cheesy. There's the pun for you. All right. So if they want to get a hold of you, Matt, best way to get a hold of you at Mobrium so they can reach out to see if they can get a review of where they're currently at and see what you can do to support them.
Yep. Yeah. Visit Mobrium.com. You can email me, Matt, MATT, @Mobrium.com, or connect on LinkedIn.
Awesome. Okay. Thank you, Matt. This has been so fun. I'm sure we're going to do this again at some point. So it'd be good to have you back here at some time. But with that, I hope everybody enjoyed this episode of Healthcare Connections podcast. If you want some additional information on your healthcare compliance, you can reach out to me at jwinn, that's JWINN, at hcp.md and healthcarecompliancepros.com. Thanks, Matt.
Yep. We'll see ya. Bye.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on Healthcare Compliance Pros, feel free to email me at jwinn@hcp.md. Don't forget to tune in next week. Thank you.